Hi, welcome back to another episode of Making Action Happen. I'm Sarah Blackhurst.
And I'm Brian McCain.
And we're here with our good friend Donald Moore, who is one of the leaders in our community on healthcare. He's been on our show before, and we asked him to come back because he's got some really great things that he's done in the last few years. A really interesting project that's a game changer really for the communities in Southern Colorado with regard to access to healthcare and how to build the clinics and how to do all those things. So we wanted to have him back. But I wanted to kind of give you a shout out. You were one of the leaders in the community that had to make some tough decisions during the pandemic, and you did this project while we were there. So we wanted to have him back and talk about it. A couple weeks ago, Senator Hickenlooper was here, and so I got to go over and see the facility, but it's really, really very cool. So, Donald, can you tell us a little bit background for people who may have not heard your the other episode with you about how you came to Pueblo and how you got into this healthcare where you're one of the big drivers?
And to be fair, that was, I think, one of our first episodes before we found our way. And, it was hello, how are you doing today?
Yeah.
What can you tell us?
Yeah, I think I was one of the first two or three that you did.
Yeah.
I was the guinea pig. Yeah. Well, thanks for having me here. I love telling the community health center story. I've been in Pueblo since 1999 with the Pueblo Community Health Center the whole time, and I've been its CEO since 2009. And healthcare is something that if a community wants a good quality of life, you have to have good access and good quality care. So I've been involved in that since 1999 here in Pueblo, and the need for healthcare just seems to have grown year over year during my time here. And I think there's several reasons for that. One, our population in Pueblo, Colorado, and the country just in general is aging. Mm-hmm. And as people get older, they rely more on the healthcare system. So that's increasing demand. Pueblo has a high rate of chronic disease. And unfortunately, we have a higher percentage of poverty and lower incomes, and that contributes to higher rates of disease, unfortunately. So that's a driver of demand. We've also seen expansions in coverage through the private market as well as governmental coverage. And when people have coverage, they're able to access care more readily, and that increases demand. And then finally, and I think this is a good trend, there's a greater recognition and understanding of how important prevention and primary care is, and that's what Pueblo Community Health Center does. We're not a hospital. We don't do traumas and kidney transplants. We are your family doctor. We're the place you go to get your kids' shots, prenatal care, and to help people attain health and maintain health so that you prevent high costs down the road or unnecessary disease. That's really what our mission is to make sure people have access to that care. So if you think about the increasing demand that I talked about, Pueblo needs more access to services that are in the prevention and the primary care arena so that we're not spending tax dollars and private dollars on avoidable costs in the future. So that's a big role that we have. And so the reason that we ventured out to build our new clinic on the east side is we had a clinic on the east side called Park Hill Clinic, opened in 2003. So we're not new to the east side, which is a disadvantaged part of our community, highest concentration of poverty. We've been there since 2003, but in about 2017, before the pandemic, we were pinched for space. The building was antiquated. It wasn't modern. It wasn't efficient. So we started a planning process, and to keep this concise, in 2019, we were able to acquire a very large piece of property on the east side that was a perfect location for expansion. And so we entered into this master planning process to build a new facility, and then the pandemic hit in 2020. But we had our plan in place. These trends driving healthcare, we knew were going to continue decades into the future. We felt like we had a good plan. It was a good idea in 2017 when we started planning. It remained a good idea in 2020 when the pandemic started. And our board made a really courageous decision to move forward with the construction, despite all the uncertainty of the pandemic. And Lou Holtz said the definition of luck is when preparation bumps into opportunity. So we had done the preparation. We had this opportunity to move forward with our plan. The board decided and approved this $31 million project. And lo and behold, a year later, what happened? Supply chain problems, a lack of contractors, et cetera. We avoided all of that by having our plan in place, the sticking to our vision of expanded access to healthcare. And we had our general contractor do an estimate of how much more expensive our project would have been if we would have waited. And they said it would have been at least $5 million more.
Wow.
Now, we're a nonprofit organization, and we had been saving money for like 10 years to invest in this new project. I don't know that we would have been able to go forward if it would have been $5 million more dollars to do the project. But we went forward. We broke ground in October of 2020. We opened the facility January 2022. And at this very moment, people are walking in and out of that clinic receiving preventative and primary health care from healthcare providers that they trust.
And how many people do you serve just in the Pueblo area?
If you look back 2 years, about 30,000 people have come and received at least one service from us in the last 2 years. In the last 12 months or in the last year, that number is about 25,000. It's about 1 out of 7 residents of Pueblo County, getting close to 1 out of 6.
And the health center network, it's very important to the Action 22 region because these health centers, they provide healthcare to the rural areas more so where we don't have anything, basically.
Yeah. I'm glad you brought that up because Pueblo Community Health Center is one of 20 community health centers in Colorado. And within the Action 22 area, in some communities, they are the access to healthcare. They're not a choice among many. They are the access. There is a community health center in Lamar, Rocky Ford, La Junta, Trinidad. We have a location in Walsenburg where we do prenatal care. The San Luis Valley, Canyon City, Salida all have community health center locations where people in need of preventative and primary health care from a trusted healthcare provider, they can go there and they're never turned away due to an inability to pay. We do receive some federal funding that allows us to offer the services. The patients pay an affordable co-payment, so they're invested in the cost of their care. But the grant covers the difference between what the patient can afford to pay and the cost of the care.
So if I walk into the health center and I don't have insurance or I'm under the poverty line, I am going to receive care. You're going to work that out for me.
Yeah. Our philosophy is let's get you into care. Let's address your needs. And then we have a sliding scale and if needed, payment plans to help people afford the care. The other thing community health centers are really good at is there's actually a lot of programs at the state and federal level to gain coverage. And sometimes people just aren't aware that they're eligible. And so we educate them. We even help them enroll. And a lot of our clients have Medicaid coverage, which is paid half by the state and half by the federal government, and it's through tax dollars. Medicaid used to be a program only for the poorest and the disabled, women and children. That program has really been transformed, and now I saw a statistic in Colorado, like 7 or 8 out of 10 people on Medicaid, they're working. They're just in low income jobs. They might not have coverage, or they're eligible for this. They're paying taxes. They're hoping to fund the system. They get the coverage. They can access the care from us. So, we don't turn anybody away due to an inability to pay. Now, sometimes we have to put limits on the number of patients we can bring in. But once you're in, we have a relationship with you, and you're going to get the care that you need.
Yeah, and that's really important too, the preventative care, because traditionally, if I don't have insurance and I'm lower income, I just sit on it, and then I get really sick and I go to the ER, which drives up costs for everybody. We've had this discussion before, insurance costs, hits the hospital, everything. So that's why this is very important.
Yep.
So let's talk a little bit about this facility. This is it's not unique in the country, but it's unique here in Colorado. It's sort of a flagship for what facilities should be looking like in the future.
Yeah. I'm so stoked to be able to talk about this because I think that our project on the east side is really going to be a showcase for Pueblo and even the state of Colorado. And the reason that is, in addition to, let me back up. The Park Hill Clinic from which we moved was about 15,000 square feet. And we had capacity to serve about 8,000 people in that clinic. And as I said, we were at max capacity. We couldn't serve any more people. Our new facility is 64,000 square feet, and we project that we could serve up to around 24,000 people there. So really triple our capacity. And if you kind of think about the next 20 to 30 years and the needs that our community is going to have, it's a vital resource for Pueblo. But in addition to achieving our primary mission of access to primary care, our board incorporated a very unique element in the design of the facility and made that part of the vision. And that unique element was a net zero energy design. Net zero energy design means that the building will produce more energy than it consumes on an annual basis. And what's important about that is several things. One is that how do I want to phrase this? There's lots of different ideas about climate change, but one thing's for sure is the cost of energy is going up and up and up. And carbon emissions seem to be contributing to a warming climate. Okay, if you accept that premise, then the goal would be to reduce carbon emissions. Net zero energy buildings accomplish that goal. The other thing that's important about the element is, I think it was in 2015, the Pueblo City Council and the Pueblo County Board of County Commissioners adopted resolutions that Pueblo County would be a leader in renewable energy use and development. And by 2035, we would be running the county's economy on renewable energy, not only from like an environmental stewardship standpoint, but from an economic development standpoint. And so we wanted to, we're the Pueblo Community Health Center, so we wanted to dovetail into the community vision as well. And then finally, the vision for this came about when we have a doctor on our board, and one day he brought me an article from the New England Journal of Medicine, and it provided a lot of evidence about how the warming of the planet was contributing to communicable diseases and declines in community health. Well, we're a community health center. We're supposed to be contributing to community health, and he just said, what if we use this project as a demonstration of how you can do a cost-effective, energy-responsible facility? And I'll be honest, when he first brought it to me, I was just like, oh, man.
That's a lot.
That's a lot. That's a lot to tackle. And I was like, well, I'm going to have to look into it because the board's asking me to do it, and I work for the board. And, we took a cost-benefit approach. I mean, we're not just going to throw money at something to have a tagline. We wanted to make sure there was an actual benefit to the cost. And make a long story short, as we worked with the engineers and the architects, we found out that for a very modest marginal cost to the project, we could actually achieve a lot of benefits. And I'd be glad to go into that if
I want to hear
absolutely.
about that.
Yeah.
Okay.
Because this is where Colorado's going, both incentive wise and mandated to a point. I think this is going to be the mandate from the state and local government. So we're curious to hear how that worked and how you fit that in.
Yeah, I agree with how you frame that. Well, no one was requiring us to do this. This really came out of the board's aspiration to set an example for the community. A project like this for a local nonprofit, it's a once in a generation project. You don't get a chance to do something like this very often. So our board was pretty jazzed and wanted to go big on this project, both in terms of our access to care and this net zero design. So a couple of figures here. So anytime you build a building, the municipal codes tell you the minimum standard you have to meet to build a building. Okay, so if you compare what the code requires to what we did above and beyond that, it added about 7% to the total cost of our project. It was about $1.1 million more than if we said, no, we're not doing that. We're just going to do the minimum. So, I mean, $1.2 million, it's a lot of money, but it was only 7% of the total project cost. Right. Mm-hmm. And so if you think about a building that's going to be in service for 50 years or more, it's a big upfront cost. But if you amortize that over the life of the building and the tens of thousands of people you're going to serve, and it's a pretty good investment. So the cost that upfront cost we were able to fund through fundraising, some of our own cash, and we got new market tax credits also to finance the entire project. But it enabled us to do that net zero design. Now, as a basis of comparison for cost effectiveness, we have a 47,000 square foot building called the Colorado Avenue Clinic over on the Mesa Junction. And that building, our new building, the East Side building, is 1/3 larger at 64,000 square foot. Mm-hmm. Our utility bills at the East Side Clinic are 25% of the utility bills at our Colorado Avenue Clinic. And we have a 50 kilowatt photovoltaic system on the roof of that building as well. Before we started construction, we conservatively projected that we could pay back that upfront investment in the net zero energy design in about 11 or 12 years. Now that we have 6 months of operating data, we've revised that estimate to about 7 to 8 years because the energy savings is outperforming the engineers' projections. Wow. Engineers are like super conservative, and they're just trying to keep you safe and making sure that your money's going to good use. So just with 6 months of data, we're seeing, first of all, we're operating on a net zero basis. In January, February, and March, we had to draw from the grid because it was winter. Yeah. You don't generate as much solar power. You're running your heating all the time. But in April, May, and June, we have been all electricity has been coming from our solar power system. And in the recent months, we're generating more than we need, which goes back to the grid, and then we get a credit for that. So we're totally on pace to be net zero certified after a year. We are the first facility in Colorado with a net zero design. We're one of 10 nationally in the healthcare industry. I should qualify that. There's tons of net zero buildings, but in the healthcare industry, we're the first in Colorado, and we're one of 10 nationally. Of the 10 nationally, none of them are certified yet. And the way that you become certified is you operate your building for a year, you collect the data on how much you generate versus what you use, you turn it into this national organization that tracks these things, and then you become certified. So PCHC in little old Pueblo, Colorado, we literally have the chance to be the first in the country to operate a net zero energy facility in the healthcare sector.
That's really cool.
That's amazing. When you're talking about this, I'm just thinking to myself, a couple things. One, that that you did this voluntarily.
Mm-hmm. Yeah.
And so when you did this voluntarily, it was above the mark. So they said this is the minimum, and voluntarily you did that. Mm-hmm. I'm also wondering if it can be a model as far as funding for things like this. If other projects want to move forward, if you're using a fund, there's funding should go to these kinds of projects and make them voluntary and say, if you voluntarily do this, we'll do this. Yeah. That's amazing. This is groundbreaking kind of stuff.
I think so. Thanks for saying it that way. One of the things I love about working for a nonprofit is your work is like, it's community benefit and it's aspirational. And what I liked about this project is the board said, hey, let's see if we can do this. This is our aspiration. Let's see if we can do it. And then as an administrator, I worked with my team, and we made a business case for it, and we made sure that it would be economically viable. Because it's great to have aspirations, but if you can't sustain it over the long run, then it's just an aspiration. So, what we learned is if you can access the capital needed to make the upfront investment, you can. There's an economic case. There's a business case for the payback on it. Right. In addition, you're lowering pollution. Okay. And whether you believe in global warming or not, like I would like to live in a community with less pollution. I'm for that. Everybody kind of understands that pollution's not good for health,
Yeah.
So there's a lot of ways to buy into this. There's an economic argument. There's a health argument. There's an environmental stewardship argument. I mean, pick the benefit that speaks to you the most, but there are benefits to doing this. So,
well, let me add one more benefit that I want you to talk about and get into is the location of this.
Yeah. Our location is on the east side of Pueblo. We are the only healthcare resource in that part of our town. We offer medical, mental health, dental, lab, pharmacy, pretty much anything you would find at a family doctor's office, plus some additional services. We offer that. As I mentioned earlier, it's the highest concentration of poverty. The City of Pueblo recently designated the east side as an urban renewal district, which means there's a formal acknowledgement of blight and underutilized properties, and that it's basically the community saying we want to redevelop and reinvigorate this neighborhood, and our Eastside Clinic is literally at the middle of that renewal district. So we currently employ about 50 employees at that site. With as we grow, we'll have up to 150 employees, and these are really good jobs with benefits. I mean, we're talking about doctors, nurses, pharmacists, medical assistants, laboratory personnel, social workers. These are people earning a decent wage who will be commuting to and from the east side. Some of our employees live on the east side. So really the key to getting the east side reinvigorated is to get more economic activity going on in there. And over the last 20 years, you've seen the library open up a branch in that area. We have located our facility in that area, and we could have moved to another part of the community. We could gotten cheaper land, but our board is pretty committed to staying reinvested in that community because of the healthcare access, but the opportunity to revitalize the neighborhood as well. But we got to get business and commercial interests in there. We need to get private investment on the east side. We need to give people a reason to want to go to the east side. A lot of the properties on the east side aren't owner occupied. They're their income properties, their rental properties. And so we don't even have a coffee shop on the east side. I mean, there's coffee shops everywhere in Pueblo, Brian, but we don't have a coffee shop on the east side. Why is that? Because no one's going to open a coffee shop where there's not activity and a civic, activity going on. So maybe, hopefully, what the library's done, what we've done, will spark some of that change. Mm-hmm. Urban renewal is going to start addressing blight and trying to attract commercial investment in the area. So I don't know. We'll have to do another show in 20 years to see if any of this pans out.
Well, we need a grocery store on the east side. That's a huge one. There's nothing over there at all. And that's something we've talked about for years. Yeah.
I think if that economic activity could get going again and people would re-migrate back into the neighborhood and own property, I think a grocery store would be. I think a lot of people would be interested in putting a grocery store over there because there'd be a market to serve.
Yeah, absolutely.
So, really quick, I was also thinking you were talking about your board. We also have an aspirational board that does that. Says, let's see what we can do. That is kind of a rare thing. It takes an amount of bravery to do this kind of a project for a board. Will you give a shout out to who is on your board of directors?
Yeah. Oh gosh. I hope I can remember everyone. Well, our board of directors are all volunteers. They're people that donate their time to oversee the mission of the community health center and to make sure that all of our money, all of our buildings, everything we do goes to that purpose, that community benefit. That's the reason we exist. And we have a great board. Another thing about our board is the majority of our board members are patients, active patients of the clinic. We are their primary care home. We're the place they trust for their healthcare needs. And right now we have 10 board members and 6 of them are patients of the health center. So let me see if I can do this. Our board president is Don Ortega, patient of the health center. He's the local market president for Premier Credit Union. I'm proud to have him as a patient. Linda Rickoff is a retired RN, and she's our past president. Yesenia Beascochea is a patient of the health center. She works for the Center for Health Progress, been a longtime patient, and a community activist and patient advocate. Proud to have her on the board. Steve Shirley, he's the Chief Information Officer at Parkview Medical Center. He's getting ready to retire at the end of the month. He's on our board. He's currently our treasurer. And finally, who am I leaving off?
Chair, vice chair, secretary, treasurer.
Of course. Our president-elect is Dr. Louis Balazet. He's a retired oncologist. And he is actually the doctor that came to visit me in 2018 and said, look at this New England Journal Medicine article. Says we got to, and he kind of asked us to look into this net zero energy design and to make it a showcase. So he gets the credit for bringing the idea to me and to the board, but the board collectively said, yeah, let's try to pursue that. Shirley Cordova is a patient board member. She works for Centura. Arthur Yarbrough works at the state hospital. He's a patient board member. He's been on our board a long time. Oh gosh, you're putting me on the spot here.
If Donald has forgotten
Michael
anybody,
Gage, who is a student support director at Pueblo Community College, he's on our board and patient of the health center. Did I name 10 people yet? I feel like I'm leaving someone off.
I wasn't counting.
I'll come back to it.
Yeah. But that just shows. So on your board, you have a lot of people that are involved with healthcare, that work in the healthcare industry, but they're patients as well.
Yeah.
And they may work for other providers,
Yeah.
So that's just a testament to your care. And I remember when we were touring it, my wife and I became patients at the health center, and she went through all of her prenatal care, and then we went over to St. Mary Corwin, and then your wife was the nurse for my wife.
Yeah.
So it was pretty cool.
Yeah. Yep. And you guys had a healthy baby.
Yep, we did. He's 6 now. And So I'm one of those guys that you have to basically tie up and take to the doctor,
Yeah.
And I was so impressed because when you went into the health center, it was very comfortable, very welcoming. It was just a warm, friendly environment. And I'm glad to see the new building on the east side because I did go tour the other building. Mm-hmm. That was a little creepy in there. It was, it was old. Yeah, it was old, but that's amazing. And again, just thank you for like everything and providing that environment for people that would instead be sitting at home and go to the ER on Monday when they don't feel good.
Yeah.
When Senator Hickenlooper was down a few weeks ago, and I was in that meeting, I think that my big takeaway was how you guys are making some game-changing decisions on access to healthcare. I think one of the things that we worried about, and you touched on it just a little bit, would you give us some specific stories or specific things that have happened that have really indicated to you and to your board and to everybody you serve how you're increasing access to healthcare?
Mm-hmm. Yeah. I think one of the main things we've done to increase access to healthcare is over the last 10 years, we have integrated behavioral health and mental health and substance abuse treatment into the medical care setting. We just refer to it as primary care. 10 years ago, primary care was pretty much thought of as medical services. Mm-hmm. Primary care now has really become more integrated, and there's recognition across the health system more and more that you need to take care of the whole person. You need to be able to address their medical, their mental and behavioral health issues, and even their oral health issues. So when we designed the clinic, we made sure all of those services were located in that facility. And so if a client comes in for a medical issue, but it really turns out that the underlying problems have to do with mental health or periodontal disease even, they don't have to go somewhere else. They can continue to access those services through their relationship with Pueblo Community Health Center. Just generically speaking, it's a pretty sad statistic, and I'm not going to remember it exactly, but most people who take their own life through suicide have had a visit with their primary care provider in the previous 6 months. And it's so being able to offer mental health screening or making it easy to access in your doctor's office, so to speak, is a way to expand access to mental health care. Okay. And so our goal isn't just more people getting medical care, it's more people having access to all of the continuum of care that really contributes to whole health. We have a pharmacy on site. That's a unique feature of our program. Our patients can go to any pharmacy in town. They can go to Walgreens, Albertson, Safeway, but we do have a pharmacy on site, primarily for patients who don't have any coverage and don't have anywhere else to go. But we serve all of our patients if they choose to use our pharmacy as well. So the other thing I think we do that promotes access is we have staff called navigators and case managers, because we don't provide everything in the healthcare system. Sometimes people need specialty care or services out in the community. And our navigators will help our patients access those services, educate them on how to use them properly, when to use them, how to prepare for the visit so that they get what they need out of the visit. So those are some examples.
I like that you brought up the point of mental health care is health care, because I was at, I'll take my Action 22 hat off and put on my UVC hat. We were having a discussion with some VA issues and clinic possible closures and that whole mess, which looking at the VA, dental is part of healthcare. That's the big one. And if on-site pharmacy is a good thing, VA, now they send them out. And anyway, they were asking what the 5 big issues were with veteran care. And also it ties into rural healthcare as well. But I said healthcare, and I listed off the other things, and they said, well, what about mental health? I'm like, no, that's part of healthcare. And they were kind of like, no, that's separate. I'm like, no, that's part of healthcare. And actually the VA, they're really good at that. They recognize that now, but there's still that stigma out there that mental health is separate from going to your primary care. And I appreciate that the VA is really tying that into their healthcare now.
It's a national trend. I mean, those mental health care and medical care, physical health care, those are just becoming more and more integrated. And, sometimes it can be intimidating to ask for mental health care. But if you have a trusting relationship with your primary care provider, you get in the exam room, it's just you and your trusted provider, and you can disclose these things and not feel like you are going to have a scarlet letter, labeled on you. And primary care providers are just, they're gifted at having the conversation to say, hey, it's okay. Like lots of people have the same deal you have, and there's really proven ways to help you. And so I consider that increased access. It's not necessarily another patient that we're counting in our statistics, but it's a patient who's now educated and understands that their total health is dependent on more than just, your blood pressure.
Yeah.
It really has to do with your mental well-being as well.
And that ties, even going to blood pressure, I mean, that ties into your mental well-being.
Yeah.
And I have a friend that's a primary care doctor, and one thing he talks to his patients, he's like, well, how are you sleeping if he notices things? And that's kind of his way in, like, you're not getting a lot of sleep. How come? Like, what's going on? Well, maybe you should talk to, Dr. So-and-so over here about this. And that's how he kind of sneaks it in. Versus that person probably not going anywhere to seek help from that.
Yeah.
I can't sleep.
A lot of times the conversation with patients start off with like, I just haven't been feeling good, but they can't really like put a finger on a specific symptom or problem. They're just like, I just feel off. And one of the questions that a patient will be asked by the primary care provider is, do you still engage in activities that are fun? Yeah. Like, do you still do the things that you're jazzed about? And sometimes people say, no, I don't ride my bike anymore. I don't go fishing anymore. But I used to go fishing all the time and loved it, but I just don't feel like going fishing anymore. That doesn't mean you're mentally ill, but it is a signal to ask more questions and investigate, like, hey, what's going on? And maybe they're having some short-term depression, or they've had an event in their life that's kind of pushed them down or crushed them a little bit, and they just need a little bit of help and support to get back to baseline, so to speak.
And coming out of a 2-year pandemic, we saw that
especially with the kids.
That's an issue, and I'm glad that they're recognizing that now. So
well, and when you talk about symptoms of other things, I think back in the day where the family doctor took care of all of those things and was paying attention, this is the evolution of that, what you're describing on that side of it. I'm curious, as you were going through this entire process, outside of your board and your group, what kind of support did you get from community leadership or others as you're doing this very innovative project that, in my opinion, checks every box of what we want this to look like in the future?
Yeah, I mean, the support was really amazing. Real quick, I remembered our newest board member, Pastor Tracy Phillips. I don't know if you know. Do you know Pastor Tracy? His first board meeting was literally this month. He's a patient of the health center. The way he found us when he moved to the community, I don't think he'll mind me mentioning this because he talks openly about it. He had a stroke about 10 years ago, and he was uninsured. And he landed in Parkview. And he didn't have a regular and usual source of care. And Parkview got him into PCHC, our Park Hill Clinic. And he will tell you that Parkview and Pueblo Community Health Center saved his life.
That's awesome.
It helped him recover from that stroke. He is a pastor on the east side. He lives on the east side. He serves the people of the east side. And he's one of our patients. He just joined our board because he sees the opportunity to serve on our board as really kind of an extension of his ministry and to give back and to help his people get connected to resources. So we're really proud to have him. He's from East Texas, and he's got a drawl that can prove it. It's been good to get to know him. But anyways, to get back to your question, remind me the question.
Oh, I was just going to say, just the kind of, you have your group, but outside the group and community support, give some shout outs to the community outside of what you did to help get this done.
Absolutely. Absolutely. Well, the moral support from the community has been tremendous. First of all, the property we bought was the former Safeway grocery store on the east side. Albertsons, which owns Safeway, announced in, I think it was like October 1st of 2016, that they were shutting the doors on November 1st, 2016. Right. There was a very short period of time of notice, and then it got boarded up the 1st of November. And that sent the community reeling. It sent the community reeling. And over time, it was clear Larry Atencio wore out a lot of shoe leather trying to find another grocery operator to come into the community and take over that property. And no one wanted to do it. I'm kind of doubtful that Albertsons would have sold it to another grocery store operator, because if you look at what they've done over the last 10 years, they closed the store on 29th. Yeah. And they closed the store down on Prairie, the grocery warehouse. And so I don't know that they would have been interested in allowing another competitor into the market. I don't know that for sure. That's my conjecture. But anyways, it got to a point where it was pretty clear that a grocery store wasn't coming in. Well, we needed to expand. The property is literally 2 blocks from our Park Hill clinic. And when we investigated that opportunity, we went to the community, went to Larry Atencio, we went to the county commissioners, we went to the East neighborhood advocacy group. And just long story short, people were sad that we couldn't have a grocery store, but we got tremendous support for acquiring that property, even though it wouldn't be a grocery store, because they saw what we've done on the Mesa Junction with the quality of that facility. They know that healthcare is an important resource for quality of life in a community, and we got that support. And really what that support meant is when it was time to get our zoning, get our permits, everyone was really kind of behind this vision of a larger healthcare facility on the east side, located in that area. So that's what I mean by moral support. Is people were they were like, "Go PCHC! You've got credibility, and we want to see you do more of what you do best." So that was great. Financially speaking, it's been great. We received a commitment of $500,000 from Pueblo County, the Board of County Commissioners. So we're grateful for that. We received a large donation from Parkview Medical Center as a part of our capital campaign. The contractor that did all the computer cabling in our building, KBL is the name of that company, they donated the cost of their subcontract to the project and did it in kind. And I think it was around $125,000 value. So we're grateful for that company stepping up. And then, our capital campaign was $3.3 million so it was about 10% of the total cost. We received $1 million grant from the Colorado Health Foundation, a private philanthropic organization. We received money from the Colorado Trust. Various the Rawlings Foundation gave us a nice donation. We had, I think, 40% of our employees do a payroll deduction and contribute to the campaign. Wow. 100% of our board members and our foundation board members contribute to the campaign. So, a lot of varieties of sources added up. And I think we're still fundraising. So if you're out there and you want to donate, give me a call. Go to our website, pueblochc.org. There's a capital campaign link on there. But we probably invested $12 million of our own money just in the development costs and the acquisition of the property and our contribution towards the project. So, roughly speaking, we financed about a third. We invested about a third of our own money, and we're raising about a third of it. So, yeah. Trying to think of other sources of support.
I think everybody supported it. I don't. There was not a single naysayer that I could recall as you were expanding.
Yeah. I mean, it's kind of like, healthcare is kind of like parks. Like, how can you be against a park?
Yeah. Right.
Or, it's something a community has to have if you want to have a good quality of life. You need good schools, you need good economic activity, you need good recreation, you need good healthcare. It's just part of the mix.
Yeah, I think that's the number two factors. If you have kids at schools, if you're going to move to a community, and then if you don't, or number two is healthcare.
Yeah.
Those are the two factors that will make or break somebody coming into your community, including businesses. That's important as well.
Yeah.
Driving manufacturing and businesses, opening a business, opening a coffee shop on these sides. That's a big part of it.
Absolutely. Yeah.
So if you want, say it one more time, if you want to donate or be a part of that, or if you're needing some help on healthcare.
Yeah. Well, for both of those things, you can go to our website, and it's pueblochc.org is our website. On that site, there's plenty of information about how to become a patient. The other way that you can become a patient is by calling 719-543-8711. Or you can just walk into 110 East Route Avenue, and an enrollment representative can serve you on a walk-in basis as well. That's if you want to establish care with us. We also have access points in schools. So we have primary care clinics at Central High School, Centennial High School, East High School, Pueblo County. We have a clinic at Chavez Huerta Preparatory Academy, K through 12. And we have a clinic at Pueblo Community College. So 6 school-based sites, we call them. You do not have to be a student of those specific schools to get health care there. If you are a District 60 or District 70 student, whether you're in one of the district schools or a charter school, you can access care at any one of those sites. So you don't have to go to East High School to use the East High School clinic. You could go to what's the charter up there near CSU Pueblo now? Bella Vida or... Yeah,
I always forget. I call it Bellevue, Bella Vida.
Something. I apologize to the people that run that school for mangling the name. But yeah, you can come to the East High School clinic if you need health care. Those were pretty much shuttered during the pandemic because remember the schools were remote or hybrid, and it's just been crazy. But we're reinvigorating those clinics this year. Matter of fact, in a couple of weeks, we're doing a sports physical blitz. So all you volleyball and softball and football and anything that requires a physical, access one of our clinics. Get your physical so that you can show up to practice on the first day with no problems. But during the school year, any of those healthcare needs, you can go in there. That's a great access point. Also, one thing about our Pueblo Community College Clinic, we are the Pueblo does a lot of things that are pretty innovative, and I think one of the things we do that's innovative, we're the only community health center physically located on a college campus in Colorado that I know of. I know for a fact we're the only community health center in a community college setting. The larger schools, they run their own clinics. They don't need a community health center. But yeah, Patty Urjavik and I got together about 6 years ago and said, hey, what if our students are your patients, and your patients are the people we want to be our students. So let's collaborate. We already have a clinic, but it's not full service. We'd like to really get it amped up. So, yeah, we moved in there in 2017, I think it was. Wow. And, the students can attend, the employees, the family of the students can come in and access healthcare. We try to make it as easy as possible. Back to the capital campaign. On our website, there's a button that says East Side Expansion. You just click on it. We've got some cool drone videos of the construction. We've got it very transparent, what the impact and benefit to the community. It's all listed out there, so you know exactly what your money's going towards. And yeah, we'd be glad to have donations of any size, 25, 250, 2,500. Whatever you got, we'll put it to use towards
2.5 million.
2.5 million would be awesome.
There you go.
Yeah.
So as we're wrapping this up, two very important questions about this. The last concert you saw and the next one you're going to. So we talk music a lot.
Yeah, yeah. The last concert I saw was Sarah Evans at the I was actually in Alexandria, Virginia, visiting my brother. We went to the Birchmere. It's a legendary music venue in Alexandria, Virginia. But let me lay this out for you, Brian. Next Wednesday, I'm going to the Goo Goo Dolls at Red Rocks. 3 days later, I'm going to Kenny Chesney at Mile High. And then the next Wednesday after that, I'm seeing Steve Earle and the Dukes up in Boulder. Do you remember them?
Oh, yeah.
Remember him from the 80s? He's great. Then I'm seeing the Goo Goo Dolls again in Buffalo, New York, their hometown, in September. I got tickets to The Who in October. And then Sarah Evans is coming to the Pueblo Memorial Hall on November 3rd. I'm going again. I'm going to see my sweetheart Sarah twice in 1 year.
That's hilarious.
Yeah.
That's awesome. Well, yeah. I managed to score Smashing Pumpkins and Jane's Addiction tickets in the front row at Ball Theater, like right up against the stage. I don't know how I pulled that off. Just that they do like the raffle and click here.
That's awesome.
And like front row, which is awesome because in high school, the first big concert I went to was Smashing Pumpkins, and I was in the front row. So it's 20 some years later, I'm going to be in the same spot.
Well, Echo and the Bunnymen are coming to Denver early September. I haven't bought my tickets yet, but I'm pretty sure I'm going to that.
I think my wife and my teenage daughter are going to
they?
that.
They're fantastic.
Oh yeah, she turned into. Dad, your music sucks. To like me catching her listen to all the 80s new wave synth stuff that I like, and she loves Echo and the Bunnymen. We missed, I think it was Tears for Fears came through with the B-52s, and we didn't even realize it happened until afterwards.
I had Foo Fighter tickets, but they canceled their tour because of the death of the drummer. I was bummed out about that.
Yeah.
They're an epic band. I was looking forward to seeing them.
Yeah.
Keep waiting for AC/DC to announce one more world tour. I hear they're scheming that up, and it might happen. So I would definitely check that out if that happens.
I know you're a fan of the AC/DC.
Thanks. That was the best question of this whole this whole session, man. Yeah. That's awesome.
Well, and then there was one more. So with the pandemic, I had tickets to concerts during the pandemic that still haven't happened yet. So there's a couple more coming around.
The Goo Goo Dolls I'm going to next Wednesday, those were tickets from summer of 2020.
Yeah, I had Enter Shikari, a British band, and they were coming in 2020, and I'm going in, I think, September, so when they're finally coming back. Yeah. So
nothing like live music.
Yeah,
it's awesome.
I missed that. That was the worst. But
totally agree.
Anyway, so if you are not a member of Action 22 and you'd like to be one, go to action22.org or email us at show@action22.org. If you have thoughts, comments, concerns, ideas about who you want to see on the podcast or hear if you're listening to this, again, just email show@action22.org. Being that it is election season, we have to throw this out every time. Action 22 does not support or endorse candidates for office, but we do offer a platform for any Action 22 member that's running for office to come on, talk about their campaign, what they're about, the issues, whatever they want. So if you are a candidate and you're a member, email us. If you are a candidate and not a member, please join Action 22 and then send us an email, and we'll let you come on here and talk as long as you want.
Chad Worthman, I know you're listening. You haven't been on the show in quite a while, so that invitation goes out to you, even though you're not running a ballot this year, and that's the reason for Mustache Gate. We'll see you guys all next week.
Thank you.